Start recording. Hello, everyone. My name is Cassie Bush, and I am the Chief of the Policy Unit for the Provider Enrollment Division. Today, we will be discussing the Regulatory Provider Bulletin titled Medi-Cal Enrollment Requirements and Procedures for Community-Based Organizations and Local Health Jurisdictions. The purpose of today's hearing is to provide you with an opportunity for discussion of the Provider Bulletin. On the left, you can see our agenda for today's stakeholder hearing. Before I begin, I have a few quick reminders. If you are experiencing any technical issues, please send an email to dhcsped.stakeholder@dhcs.ca.gov for help. Please hold all questions until the end of our presentation. We will have plenty of time for comments and questions at the end. If you would like to submit a comment or question, you may do so via the chat box or raise your virtual hand in WebEx, and we will unmute you. Please be sure to send any questions or comments made in the chat box to everyone. We will discuss in further detail at the end of the presentation. Only written comments received by email by 5:00 p.m. today will be considered prior to publication of the final bulletin. You may send your written comments to the following email address: dhcsped.stakeholder@dhcs.ca.gov. When submitting your comments, please make sure you reference your name, organization, if you're affiliated with one, and the bulletin title. This hearing will be recorded and posted on the Provider Enrollment Division website for future reference at a later date. Today, we will be going over the drafted provider bulletin titled Medi-Cal Enrollment Requirements and Procedures for Community-Based Organizations and Local Health Jurisdictions. As a reminder, a copy of the draft provider bulletin was attached in the stakeholder invitation email for this hearing, which was sent on November 1st, 2023. This bulletin is establishing the Medi-Cal provider enrollment requirements for community-based organizations, CBOs, and local health jurisdictions, LHJs, that provide community health worker and/or asthma preventative services. Effective January 9th, 2024, CBO and LHJ providers may apply for enrollment in the Medi-Cal program by submitting an electronic application through the Provider Application and Validation for Enrollment, PAVE, online enrollment portal, along with all supporting documentation. We will now go to Hua, who will review the draft bulletin in more detail.
Good morning, everyone. My name is Hua Tran, and I'm an analyst in the Policy Unit for the Provider Enrollment Division. I will now go into more detail about the Medi-Cal provider enrollment requirements and standards. All CBO and LHJ applicants must meet current Medi-Cal provider enrollment requirements and standards, as well as the requirements set forth in this bulletin. Furthermore, Medi-Cal enrollment standards require applicants to abide by all state and local laws and ordinance pursuant to California Code of Regulations, CCR, Title 22, Section 51000.30E and 51000.60C4. These requirements and standards include, but are not limited to, obtaining the applicable business license when required by local laws and ordinance, and having a Type 2 National Provider Identifier, NPI. Now we will go over the organization structure for CBO and LHJs. CBOs must be a public or private nonprofit organization with a 501c3 status, or a fiscally sponsored entity of a 501c3 nonprofit organization. For a CBO provider with a 501c3 status, the CBO shall provide 501c3 documentation. For a CBO provider that is fiscally sponsored entity of a 501c3 nonprofit organization, the CBO shall provide a letter from the sponsoring entity that attests to their arrangement and status. and proof of the 501c3 status for the sponsoring entity. This letter must be on the sponsoring entity letterhead. For LHJs, the LHJ provider must be a city or county public health department. CBO and LHJ applicants must have at least one administrative location in California, which must be reported on their application. This administrative location shall not be a private residence and may not be reported using a post office. For the purpose of this provider bulletin, an administrative location is defined as the physical location associated with the CBO and LHJ operations, which can include where services are dispatched or based. DHCS recognizes that the actual services may occur at administrative locations, but may also occur solely in community settings, which do not have to be separately enrolled. For the purpose of this provider bulletin, a community setting is defined as a location where persons employed by or contracted with a CBO or LHJ provider furnish services outside of their administrative locations. For the reported administrative location, CBO and LHJ applicants must provide a signed lease agreement or written verification from the space owner that the space is being donated for the purpose of operating a CBO at no cost. Maintain valid workers' compensation insurance and comprehensive general liability insurance that cover the reported administrative location and operations. Have permanently posted signage identifying the name of the CBO or LHJ and the business hours. The regulation citations are included on this slide as well as in the bulletin for your reference. The administrative address reported on the application will appear in provider directories and in the California Health and Human Services Open Data Portal. Next is the attestation requirements. CBO and LHJ applicants offering CHW services must attest that all of their CHWs for whom they will bill either DHCS or a managed care plan contracted with DHCS for the delivery of CHW services provided to members enrolled in Medi-Cal meet the qualifications listed in the state plan for CHW. Additionally, the CBO and LHJ applicants must attest that they understand that DHCS may audit the CBO or LHJ to verify CHW qualifications and services provided, and that the CBO and LHJ must supply documentation upon request of DHCS. Please note that this attestation does not supersede any of DHCS authority to audit or request records from the provider pursuant to state and federal law and the provider agreement. This attestation is built into the electronic application through PAVE. There is a separate attestation for providers offering AP services for unlicensed AP service providers, which asks the applicant to attest to the same requirements as mentioned in the previous slide, but specifically for AP service providers. Again, this attestation is built into the electronic application through PAVE. Now I will turn it back to Cassie.
Thank you for listening to our presentation about the Medi-Cal enrollment requirements and procedures for community-based organizations and local health jurisdictions. You may submit any comments or questions regarding this provider bulletin to dhcspedstakeholder@dhcs.ca.gov. Written comments are due by 5:00 p.m. today. If you would like to ask a question or share a comment now, you may either raise your virtual hand or type your name in the chat box and we will unmute you so you can ask your question verbally, or you can type the question in the chat box and we will respond. Please be sure to send any questions or comments made in the chat box to everyone. Now I would like to pass it over to Meryl for the Q&A part of the webinar.
Thank you, Cassie. Hi, everybody. I'm Meryl Young. I'm a Section Chief over at Provider Enrollment Division, and I am going to handle the Q&A here. We have here, and we'll also be looking out for any raised hands as well, but we have a couple of questions that were submitted in the chat that hopefully you can all see. One is, will you be providing a recording of this webinar or slides to us afterwards? Yes, we will. We will be posting a video of this webinar for your reference, and also we will be sending responses to any questions asked here, posting them online and sending them to attendees. So we'll be covering that. Next is the question: how long will the approval process take? If there's a complete application submitted on January 9th? So the CBO LHJ applications are going to be on the 180-day clock, meaning that the department has 180 days to take a statutory action on one of these applications. We, of course, at Provider Enrollment Division, do our best to work our applications sooner than that, and providers can help us by submitting a complete application that includes all of the information that's requested. That will prevent us from having to send the application back to efficient, and from CBOs and LHJs from having to resubmit those applications. So that will speed the process along. So those so far are the only questions that are in the chat. Do we have any raised hands out there?
Not seeing any raised hands, but if anyone wants to unmute themselves, you can also put your name in the chat and we can unmute you from our end as well.
So we've had another question in the chat while we're waiting for folks to raise their hands. Is this the same process for the justice providers? So there'll be more details to follow about the justice involved enrollment for these provider types. So that will happen at some point next year, and is not currently something that's available in the CBO LHJ package that we're talking about now. But more to come on that. All right, again, great opportunity for folks. If they have any questions, to go ahead and put that in the chat, or ask to be unmuted. We have an additional question: are these provider types screened at the limited level? So as folks may be aware, different provider types have different levels of screening, and the CBO LHJ is indeed at the limited risk level. Question: will a checklist be available before January 9th to help providers be ready? We do have on our provider enrollment page information available for each provider type, where we do our best to spell out what all the requirements are, and we will do that as well. And if you think you would benefit, or this provider type would benefit for additional resources, please send that to our DHCS stakeholder email. That will help determine whether that need is broader.
And we do have one raised hand, Alexandria Parma. I'll be unmuting you now. If you have a question or comment, please ask it at this time.
I'm here today representing the First Five Association of California. Thanks for the opportunity to give comment today. My comment relates to community-based organizations who are currently enrolled with their local managed care plans, or about to be enrolled for the community health worker benefit to provide services. Over the past couple of months, without a state pathway for CBOs to enroll as Medi-Cal providers, since the benefit launch, these CBOs were instead vetted by their MCPs as outlined in the APL. Once the PAVE online enrollment portal opens to CBOs, we would just encourage the department to think about how these CBOs can continue working with the clients and families that they're serving while they're working to enroll in the state pathway, that there's no kind of gaps in services, that they can have an on-ramp of time to make sure they get everything set in the online enrollment portal. So come January, they are continuing to serve families while also working to be enrolled at the state pathway once it's available. Thank you.
Yeah, thank you for sharing that, and certainly send it over to the DHCS stakeholder email. There's plenty of folks here today listening who are receiving what you're saying, and we'll pass that on when you submit it as well. All right, we have a couple more questions in the chat. Are home health or hospice agencies considered to be a CBO provider type? This CBO licensed health jurisdiction and provider type is for providers that are providing the community health worker and asthma prevention services solely. I know that there are provider types that are able to provide each of these services separate from having to enroll. Nothing has changed in that regard. I hope it answers your question. Also, is this for new providers only, or do current DMC providers have to reapply by January 9th? Is this different from DMC enrollment in PAVE? My answer to that is if DMCs are already able to provide these services, then there's no change. Again, this is for community-based organizations and local health jurisdictions that are currently not able to provide those services, given their current provider types. Another question we have is, how extensive will the application be? Will assistance be provided by DHCS to smaller CBOs with no experience being a Medi-Cal provider? I think, like I mentioned earlier, the resources that we provide will be in part driven by the comments that you send. As far as it being an extensive application, we obviously have a range of application types and reporting requirements. That a lot of that depends often on how complex the ownership structure is. I would say that based on comparison to more complex provider types, I think it's relatively simple. But again, your concern is noted, and based on the comments that we received, that stakeholder email box and here today will help us determine the amount of resources that we need to make available to ensure proper kickoff of this enrollment. Any other questions from anybody, or any more comments for the chat? I know this is a little bit of a silence here, but I just want to be sure that folks have an opportunity to ask their questions and be responded to before we wrap up. The question is, sorry to be late. Can you restate what comments are due today? Sure, you'll hear this again in a moment, but we need any feedback or comments based on this enrollment bulletin to be sent to the DHCS PD stakeholder email that you can see on your screen, and you'll hear mentioned here shortly. We'd like those to be submitted by 5 o'clock. Your comments that you have shared in the chat and that we discussed, we'll certainly consider, but we would really like those in writing as well. We have a few more comments. This is great. do each of the plans have their own provider enrollment process too, or is there a standardized process for all plans to follow? Shannon, you can raise your hand and we can unmute you if I get this wrong, but if you're talking about a plan's ability to have their own enrollment equivalent to what the department does, I'd have to refer you back to the all plan letter that addresses enrollment. And we'll put a link to that all plan letter in our responses to this bulletin hearing that we send out. And if I have that wrong, you can raise your hand and ask it a different way. Where do I find that enrollment bulletin? If we're talking about this enrollment bulletin that was sent out to everybody, and Michelle, if you don't have the draft bulletin and you send an email over to DHCS stakeholder, we'll be sure you get it. As mentioned, we're going to share this presentation, and this is being recorded right now. Andrew, thank you again for comment about tutorials and webinars for CBOs, and thank you. A couple of folks have put a link to the bulletin in the chat, so there we are. And I'm going to respond to that thank you with thank you, folks, for all being here and attending. We don't have any more comments or raised hands. I'm going to go ahead, Cassie, and hand it back to you.
Thank you, Merold. As a reminder, any comments not shared during the hearing can be sent via email. All comments, feedback, and/or questions must be sent to DHCSPED stakeholder@dhcs.ca.gov and received by 5:00 p.m. today for consideration for the final version. Thank you again for your attendance and for your participation. This hearing is now adjourned.